Question 1. In the context of insurance claims, what is the definition of medical necessity? A. Any service a physician decides to perform for a patient. B. Services or supplies needed to diagnose or treat an illness, injury, condition, or disease, which meet accepted standards of medicine. C. Experimental or investigational procedures requested by the patient. D. The least expensive treatment available for a patient's condition, regardless of outcome. Answer: B. Services or supplies needed to diagnose or treat an illness, injury, condition, or disease, which meet accepted standards of medicine. This question tests the foundational concept of medical necessity, which is the cornerstone of reimbursement. The keywords needed to diagnose or treat and accepted standards of medicine are critical clues, as insurance payers will only cover services that are appropriate and essential for the patient's condition. For example, prescribing an antibiotic for a documented bacterial infection is medically necessary, but prescribing it for a viral cold is not. A helpful tip is to remember that for a service to be paid, it must be justified by the patient's diagnosis and be considered standard, effective care, not just something the patient or doctor wants. Question 2. What does the medical suffix ectomy signify? A. Surgical creation of a new opening. B. Visual examination of an organ. C. Surgical removal or excision. D. Surgical repair or reconstruction. Answer: C. Surgical removal or excision. This question assesses knowledge of common surgical suffixes, with ectomy being one of the most frequent. The suffix itself means the surgical removal of a specific body part. For instance, an appendectomy is the surgical removal of the appendix, and a tonsillectomy is the removal of the tonsils. Understanding this suffix allows a coder to quickly grasp the nature of a procedure described in an operative report. A simple way to keep it straight is to think E4 ectomy and E4 excision or exit, meaning something is being taken out. Question 3. Which statement best describes the difference between fraud and abuse in medical billing? A. Fraud is accidental, while abuse is intentional. B. Fraud involves intentional deception for payment, while abuse involves actions that result in unnecessary costs without intent to deceive. C. Fraud and abuse are interchangeable terms for improper billing. D. Abuse is a criminal offense, while fraud results in civil penalties only. Answer: B. Fraud involves intentional deception for payment, while abuse involves actions that result in unnecessary costs without intent to deceive. This question tests the critical compliance concepts of fraud and abuse, which have distinct legal and financial consequences. The key difference lies in intent. Fraud is the intentional act of deceiving to gain a benefit, such as billing for services never rendered. Abuse refers to practices that are inconsistent with sound medical or fiscal standards, resulting in unnecessary costs, like misusing codes on a claim without meaning to deceive. For example, knowingly billing for a comprehensive exam when only a brief one was performed is fraud, while repeatedly making coding errors due to poor training could be considered abuse. Think of it this way: fraud is purposeful lying for money, whereas abuse is bending the rules, often unintentionally, in a way that costs the system. Question 4. In ICD-10-CM, what does an excludes one note indicate? A. The two conditions are unrelated and can be coded together. B. The excluded code should never be used at the same time as the code above the note. C. The excluded code is a component of the primary code and is not coded separately. D. The patient may have both conditions, but they must be sequenced in a specific order. Answer: B. The excluded code should never be used at the same time as the code above the note. This question addresses a fundamental ICD-10-CM coding convention, the excludes one note. The key concept is that excludes one signifies mutual exclusivity, meaning the two conditions represented by the codes cannot occur together. For example, an acquired form of a condition cannot be coded with a congenital form of the same condition because a patient cannot have both simultaneously. A helpful way to remember this is to think of excludes one as a stop sign. You cannot code the two conditions together under any circumstances. Question 5. HCPCS Level II codes are primarily used to report what? A. Physician services and procedures. B. Inpatient hospital surgical procedures. C. Services, supplies, and equipment not included in CPT, such as ambulance services and durable medical equipment. D. The severity of a patient's illness. Answer: C. Services, supplies, and equipment not included in CPT, such as ambulance services and durable medical equipment. This question tests the purpose of HCPCS, Healthcare Common Procedure Coding System, Level II codes. While CPT, HCPCS Level I, codes cover physician procedures, HCPCS Level II codes are used for a different set of items. They identify products, supplies, and services not found in CPT, such as injectable drugs, prosthetics, and durable medical equipment, DME, like wheelchairs or oxygen tanks. For example, if a provider administers a specific drug in the office, a J-code from the HCPCS Level II book would be used to bill for the drug itself, while a CPT code would report the administration service. Remember, if it is a thing, a supply, drug, or piece of equipment, rather than a doctor's action, it is likely a HCPCS Level II code. Question 6. What is the primary purpose of CPT Modifier 25? A. To indicate that a procedure was performed by two different surgeons. B. To signify that a significant, separately identifiable evaluation and management (E/M) service was performed by the same physician on the same day as a minor procedure. C. To report a discontinued procedure. D. To indicate that the professional component of a service is being billed separately. Answer: B. To signify that a significant, separately identifiable evaluation and management (E/M) service was performed by the same physician on the same day as a minor procedure. This question assesses the proper use of Modifier 25, a crucial modifier in E/M and procedural coding. The keywords significant, separately identifiable are key, as this modifier tells the payer that the E/M service went above and beyond the usual pre- and post-operative care included with the minor procedure. For example, if a patient comes in for a scheduled mole removal, a minor procedure, but also has a new, unrelated problem like severe chest pain that the physician must evaluate extensively, Modifier 25 would be appended to the E/M code. A good way to remember is, Modifier 25 justifies getting paid for both the thinking, E/M service, and the doing, the procedure, on the same day. Question 7. In pathology, what does the term in situ mean when describing a carcinoma? A. The cancer has spread to distant lymph nodes. B. The cancer is invasive and has penetrated the surrounding tissue. C. The cancer is a non-cancerous, benign tumor. D. The cancer is confined to the site of origin and has not invaded the basement membrane. Answer: D. The cancer is confined to the site of origin and has not invaded the basement membrane. This question tests the understanding of a key term in oncology and pathology, in situ. This term describes a very early stage of cancer where the abnormal cells are still contained within the layer of tissue where they started. It is considered a pre-invasive or non-invasive cancer because it has not spread into deeper tissues or other parts of the body. For example, ductal carcinoma in situ, CIS, is a non-invasive breast cancer where the abnormal cells are confined to the milk ducts. A simple way to remember is to think of in situ as meaning in its original situation or in place. Question 8. In radiology coding, what does the professional component of a service represent? A. The cost of the equipment, supplies, and technician's salary. B. The radiologist's work in supervising the procedure and interpreting the images to write a formal report. C. The global fee, including both the technical and interpretive work. D. The billing services fee for submitting the claim. Answer: B. The radiologist's work in supervising the procedure and interpreting the images to write a formal report. This question focuses on the concept of component billing in radiology, specifically the professional component. The keyword to focus on is professional, which refers to the physician's cognitive work. When a radiologist interprets an X-ray, CT scan, or MRI and dictates a report of the findings, that work is the professional component, typically billed with modifier 26. The use of the equipment, the room, and the technologist's time is considered the technical component, billed with modifier TC. A helpful tip is to associate professional with the specialized knowledge and interpretation provided by the doctor. Question 9. According to CPT guidelines, a new patient is one who has not received any professional services from the physician or another physician of the exact same specialty and subspecialty who belongs to the same group practice within the past __________. A. 1 year. B. 2 years. C. 3 years. D. 5 years. Answer: C. 3 years. This question tests the CPT definition of a new patient, a critical factor in selecting the correct evaluation and management E/M code. The 3-year rule is a firm guideline used to differentiate between a new and an established patient. If a patient has not been seen by the physician or a same specialty colleague in their group practice within the last 3 years, they are considered new for billing purposes. For example, a patient who last visited their primary care physician in the same group on January 1, 2020, would be considered a new patient if they returned on January 2, 2023. Think of it as a 3-year reset button for patient status in a practice. Question 10. The HIPAA privacy rule establishes standards to protect individuals' medical records and other identifiable health information. What is this information called? A. Private health information, PHI. B. Personal medical information, PMI. C. Protected health information, PHI. D. Confidential patient data, CPD. Answer: C. Protected health information, PHI. This question tests knowledge of a core HIPAA term, with the key concept being the specific name for the information protected by the privacy rule. This information is officially called protected health information, commonly abbreviated as PHI. PHI includes any demographic information that can be used to identify a patient, such as name, address, date of birth, or social security number, combined with their health conditions, treatments, or payment information. A useful way to remember is that HIPAA's job is to protect health information, which directly leads to the term protected health information. Question 11. In ICD-10-CM, what is a sequela? A. A chronic condition that is present from birth. B. An acute illness with a rapid onset and short duration. C. The residual effect, late effect, of a prior acute illness or injury. D. A condition that is a direct complication of a surgical procedure. Answer: C. The residual effect, late effect, of a prior acute illness or injury. This question defines the term sequela, an important concept for accurate ICD-10-CM diagnosis coding. A sequela is a condition that remains after the acute phase of an illness or injury has ended. For instance, a scar that forms after a burn has healed is a sequela of the burn, and paralysis that remains after a stroke is a sequela of the stroke. When coding for a sequela, two codes are usually required, one for the residual condition itself and a second for the sequela, indicating the original cause. A good way to remember is to think of sequela as the long-term sequel to a past injury or illness. Question 12. What is a National Provider Identifier, NPI? A unique 10-digit identification number for covered healthcare providers. B. An internal medical record number assigned to a patient. C. A tax identification number issued by the IRS. D. A license number issued by a state medical board. Answer: A unique 10-digit identification number for covered healthcare providers. This question asks for the definition of a National Provider Identifier, NPI, a fundamental element in healthcare administration. An NPI is a standard, 10-digit numeric identifier required by HIPAA for all covered healthcare providers, including individuals like physicians and organizations like hospitals or clinics. It is used in administrative and financial transactions to uniquely identify a provider, simplifying claim processing across different payers. For example, every claim submitted to an insurer must include the NPI of the billing provider and the rendering provider. The key takeaway is to remember that the NPI is like a social security number for healthcare providers, used for all standard electronic transactions. Question 13. Which anatomical term means farther from the trunk or point of origin of a body part? A. Proximal. B. Distal. C. Medial. D. Lateral. Answer: B. Distal. This question tests knowledge of basic anatomical directional terms, specifically the relationship of body parts to the trunk. The term distal describes being farther away from the center of the body or the point of attachment. For example, the hand is distal to the elbow, and the toes are distal to the ankle. Its opposite, proximal, means closer to the trunk. A simple way to remember is that distal sounds like distant, meaning it's farther away. Question 14. What is a comorbidity? A. The primary reason for a patient's hospital admission. B. A condition that develops as a result of a hospital stay. C. An additional condition that exists at the same time as a primary condition. D. The expected outcome of a disease. Answer: C. An additional condition that exists at the same time as a primary condition. This question defines the clinical term comorbidity, which is important for capturing the full picture of a patient's health. A comorbidity is a medical condition that a patient has in addition to their primary diagnosis. For example, if a patient is being treated for pneumonia, the primary condition, but also has a history of diabetes and hypertension, the diabetes and hypertension are comorbidities. Identifying and coding for comorbidities is crucial as it can affect the patient's treatment plan and demonstrates medical necessity for more complex care. A good trick is to break down the word. Co-means together, and morbidity relates to disease, so it literally means diseases together. Question 15. In medical billing, a clean claim is a claim that A. Has been paid in full by the insurance company. B. Is submitted on paper instead of electronically. C. Contains no errors and can be processed without needing additional information. D. Has been denied and is being appealed by the provider. Answer: C. Contains no errors and can be processed without needing additional information. This question tests the definition of a clean claim, a key goal in the revenue cycle management process. A clean claim is one that is submitted to an insurance payer with all the required information being accurate and complete, allowing it to be processed and paid promptly without being rejected. This includes correct patient demographics, provider information, diagnosis codes, and procedure codes. The objective for any biller or coder is to submit clean claims to ensure a steady and timely cash flow for the provider. Think of a clean claim as having a green light at the insurance company. It can pass through without any stops or questions. Question 16. The medical prefix Brady - refers to which of the following? A. Fast. B. Slow. C. Painful. D. Difficult. Answer: B. Slow. This question tests knowledge of common medical prefixes that describe rates or conditions. The prefix Brady - specifically means slow. This is frequently seen in terms like bradycardia, which means an abnormally slow heart rate, or bradypnea, which means an abnormally slow breathing rate. To remember this, you can associate Brady - with a slow-moving animal like a bear. Though not related, the BR sound can be a hook, and its opposite, tacky - which means fast. Question 17. In ICD-10-CM coding, what is the primary function of the placeholder character X? A. To indicate that a code is for an external cause of injury. B. To allow for future expansion of a code category. C. To fill empty character positions when a seventh character is required but the code is less than 6 characters long. D. To mark a code as unspecified. Answer: C. To fill empty character positions when a seventh character is required but the code is less than 6 characters long. This question covers a specific and important convention in ICD-10-CM coding, the use of the placeholder X. Some ICD-10-CM codes require a seventh character to provide additional detail, such as the episode of care for an injury, initial, subsequent, or sequela. If a code is only 4 or 5 characters long but needs that seventh character, the X is used to fill the empty spots in the 5th and or 6th position. For example, the code for a toxic effect of an accidental overdose of aspirin is T39.011, which needs a 7th character for the encounter type. The placeholder X is used to make it a valid 7-character code, like T39.011A. Think of X as the character that marks the spot to ensure the 7th character is in the correct position. Question 18. A medical term that is named after a person, such as Parkinson's disease or Alzheimer's disease, is known as a, N. A. Acronym. B. Eponym. C. Homonym. D. Synonym. Answer: B. Eponym. This question tests the definition of an eponym, a common feature in medical language. An eponym is a disease, structure, procedure, or syndrome named after a person, typically the individual who discovered or first described it. Well-known examples include Hodgkin's lymphoma, named after Thomas Hodgkin, and the Foley catheter, named after Frederick Foley. Recognizing eponyms helps coders locate the correct terms in the alphabetic index, as they are often listed under the person's name. A helpful memory aid is to connect the P in eponym with the P in person. It's a term named for a person. Question 19. If a patient develops a new condition as a direct result of medical treatment or a procedure, the condition is referred to as A. Congenital. B. Idiopathic. C. Iatrogenic. D. Acute. Answer: C. Iatrogenic. This question defines the term iatrogenic, which is crucial for understanding complications of care. An iatrogenic condition is an illness or injury that is caused by medical examination or treatment. For example, a postoperative infection that develops at the surgical site or an adverse reaction to a prescribed medication would be considered iatrogenic. This term is important in coding as it often requires specific codes to identify the condition as a complication of care. To remember it, Think of the genic part meaning originating from, so iatrogenic means originating from a physician or medical treatment. Question 20. The practice of unbundling in medical coding refers to A. Using a single comprehensive code that covers all related services. B. Submitting a claim with insufficient documentation. C. Using multiple separate CPT codes for the parts of a procedure that could be reported with a single code. D. Reporting services that were not medically necessary. Answer C. Using multiple separate CPT codes for the parts of a procedure that could be reported with a single code. This question addresses the improper coding practice of unbundling, a key compliance issue. Unbundling, also known as fragmenting, occurs when a coder bills for multiple, separate procedure codes when a single, more comprehensive bundled code is available and appropriate. This is often done to increase reimbursement but is considered fraudulent or abusive billing. For example, instead of using a single code for a hysterectomy, a coder might bill separately for the removal of the uterus, removal of the fallopian tubes, and removal of the ovaries, which is incorrect. Remember, unbundling is like taking apart a complete package to sell the pieces separately for more money, something payers do not allow. Question 21. What is the key difference between CPT Category I and Category 3 codes? A. Category I codes are for supplies, while Category 3 codes are for procedures. B. Category I codes are for established procedures and services, while Category 3 codes are temporary codes for emerging technology and services. C. Category I codes have 5 numbers, while Category 3 codes have 5 letters. D. Category I codes are used for inpatient settings, while Category 3 codes are for outpatient settings. Answer B. Category I codes are for established procedures and services, while Category 3 codes are temporary codes for emerging technology and services. This question tests the distinction between two major CPT code categories. Category I codes are the standard, 5-digit numeric codes that describe procedures and services approved by the AMA and widely performed by physicians. In contrast, Category 3 codes are alphanumeric, for numbers followed by a T, temporary codes used to track the use of new and emerging technologies, services, and procedures. These temporary codes allow for data collection before a decision is made on whether to approve them as permanent Category I codes. Think of Category I as the official, permanent set of codes, and Category 3 as the temporary, trial set for new innovations. Question 22. In an inpatient hospital setting, what is the definition of the principal diagnosis? A. The most severe condition the patient has upon admission. B. The condition established after study to be chiefly responsible for occasioning the admission of the patient to the hospital. C. The first diagnosis listed on the physician's admitting note. D. Any chronic condition that requires ongoing treatment. Answer B. The condition established after study to be chiefly responsible for occasioning the admission of the patient to the hospital. This question addresses the definition of the principal diagnosis, which is the foundation of inpatient, hospital, coding. The keyword is chiefly responsible, as the principal diagnosis is the main reason the patient required admission to the hospital after all studies and workups are complete. For example, a patient admitted with chest pain who is ultimately diagnosed with an acute myocardial infarction, heart attack, would have the heart attack listed as the principal diagnosis. Getting this right is critical because it determines the Medicare Severity Diagnosis Related Group, MSDRG, assignment, which dictates the hospital's reimbursement. A good tip is to remember the principal diagnosis answers the question, why was this patient admitted to the hospital? Question 23. What is the purpose of the National Correct Coding Initiative, NCCI, edits? A. to ensure providers are using the most current ICD-10-CM diagnosis codes. B. To promote correct coding methodologies and prevent improper payment for procedures that should not be billed together. C. To set the fee schedule for physician services. D. To define the difference between a new and an established patient. Answer: B. To promote correct coding methodologies and prevent improper payment for procedures that should not be billed together. This question covers the role of the National Correct Coding Initiative, NCCI, a program developed by the Centers for Medicare and Medicaid Services, CMS. The primary goal of NCCI edits is to prevent improper billing by identifying pairs of codes that should not be reported together for the same patient on the same day. These procedure-to-procedure edits are based on coding conventions, national and local policies, and standard medical practice. For example, an NCCI edit would prevent a provider from billing for a simple repair at the same site as a more complex repair, as the simpler service is considered part of the more complex one. Think of NCCI edits as an automated checker that helps ensure coders don't double-dip by billing for overlapping services. Question 24. The medical suffix plasty refers to A. Surgical puncture to remove fluid. B. Surgical fixation or fusion. C. Visual examination with a scope. D. Surgical repair, restoration, or reconstruction. Answer: D. Surgical repair, restoration, or reconstruction. This question tests another common surgical suffix, plasty, which is vital for understanding procedural reports. The suffix plasty indicates that a surgical procedure was performed to repair, reshape, or reconstruct a part of the body. For example, a rhinoplasty is the surgical reconstruction of the nose, and an arthroplasty is the surgical reconstruction or replacement of a joint, like a total knee replacement. A helpful way to remember is to associate plasty with plastic surgery, which is focused on molding or repairing body structures. Question 25. An Advance Beneficiary Notice, ABN, is a form given to a Medicare beneficiary to sign when A. The provider is billing the patient for a co-payment or deductible. B. The provider is referring the patient to a specialist. C. The provider believes a service may not be considered medically necessary by Medicare and will not be covered. D. The patient is being admitted to the hospital for an inpatient stay. Answer: C. The provider believes a service may not be considered medically necessary by Medicare and will not be covered. This question covers the purpose of an Advance Beneficiary Notice, ABN, a crucial form in Medicare billing. An ABN is a written notice that a provider gives to a Medicare patient before a service is rendered, stating that Medicare will likely deny payment for that specific item or service. By signing the ABN, the patient acknowledges that they have been informed and agree to be held financially responsible if Medicare does not pay. For example, if a patient requests a screening test more frequently than Medicare allows, an ABN must be signed before the test is done if the provider wishes to bill the patient. The key takeaway is that an ABN protects the provider by transferring financial liability to the patient with their advance knowledge and consent.